Sometimes people try to discuss it with the AI for a long time, so they might miss the golden period to treat the person.
现在我们是第二个话题，我们会讨论 AI 对于病人看诊、医生接诊之间会产生的各种问题，我们会做一个简单的讨论。With the rise of the AI tools, many patients are researching their symptoms and even forming their own conclusions before seeing a doctor. Have you noticed this trend in your practice?
In West Malaysia, not very much because there a lack of technology. But here in East Malaysia, I encounter some say they just Google it. In terms of AI, they still not very much knowing about it.
Do you think AI could also support doctors in some ways?
I think yes, because AI they have limitless memory.
Yeah,
so doctors can sometimes just ask them what they might have forgotten.
and AI is no longer just about searching for information. In China, there are already systems sometimes refers to as AI doctors. For example, one is called Afu. This is an AI doctor in China.
Or like ChatGPT.
But just for people,
medical.
yeah, for medical, yeah. This can analyze certain medical-related questions. Even in traditional Chinese medicine, there are emerging applications like AI tongue diagnosis and AI pulse diagnosis, using images and data to make assessment. So in a way, AI is starting to enter areas that were once considered very difficult to replace. From your perspective, when AI starts to move into these more complex areas, what do you think are the limitations that people might not be aware of?
For the good parts, AI is very good. They did not need to go to the hospital.
Yeah.
They just taking care at home only or provide the medication what they need. Either they can go to pharmacy or the hospital after that. So the bad side is when things need to be urgent, like chest pain, shortness of breath, neurological deficits. They need to quickly come to the hospital because there's no time for this discussion. They just go to the emergency. But sometimes people try to discuss it with the AI for a long time, so they might miss the golden period to treat the person. So I think it's a good thing for preparation. AI is AI, but for urgent things, the doctor still need to become the decision maker for urgent things.
Yeah, from my own observation, one thing about AI is that it can sometimes tend to align with the user's concerns. If a patient already has a certain worry or perception, AI may lean in that direction when providing explanation, rather than strictly focusing on objective symptoms or data. I have also come across cases where patients being incorrect AI-generated advice and ended up taking the wrong medicine. And in those situations, AI doesn't really bear responsibility. At most, it can only respond with something like, "I'm sorry." Do you think patients might sometimes overtrust AI because of how confidently it presents information? And how should we balance that with professional medical advice?
Yeah, AI may make your treatment fragmented. They will try to combine it with traditional method, with the modern method, until the diagnosis turns a lot of diagnosis. For example, you are having a stomach pain and the AI may think it's food poisoning. But after we go to the clinic hospital, we do some tests where AI cannot do that, and we find it's peptic ulcers by Helicobacter pylori. It might be wrong sometimes because they are unable to make testing like at the hospital or the clinics.
In your opinion, what types of conditions should never be self-diagnosed or managed without professional input?
Things that is very urgent, like chest pain, is very usual, and mental health. So I think it needs human interaction. Children, the elderly, because their condition keep evolving. At first, maybe chest pain, then suddenly seizure come. Then we don't know their drug, what drug they take, what history they have in the past. If patients, they might search for not a detailed things like the doctors do.
Yeah.
So it might cause confusion.
Do you think the role of doctors is shifting from decision makers to more of advisor or interpreters?
I think doctors still the decision maker.
Yeah.
Because for things that are urgent, like at the red zone, at the hospital emergencies.
Maybe in the future,
In the futures,
with the development of AI.
for the near future, maybe no. And AI can help things like non-communicable disease, like hypertension, diabetes. They can collaborate with the doctors to adjust their medication and lifestyle. things like urgent things in the near future maybe not lah, but things keep evolve, and who knows?
Yeah, who knows?
I hope so lah. It will take the doctor burden a little bit lah.
And there are not that much patients have to wait at your clinic.
Yeah, should be like that lah. Should be improved like that. I hope so.
Yeah. If patients want to use AI as a tool, what would you consider a responsible way to use it?
Yeah, I think patients should use AI, but not trust it completely to become a decision maker. You can ask the AI what my symptoms, is it urgent or not, and what should I ask the doctors when I come to clinic about my symptoms, things like that, but not to jump to the conclusion that I have this diagnosis from the AI perspective.
Yeah.
Because they might change it, the AI, they bear no responsibility. You might regret it later. Better you see the doctors before coming to any conclusion.
We cover all the questions.